Sorry, the doctor saying.
Okay, you can ask him.
Wait a minute. He must.
I think, Bob, if you're ready.
Yes,
She's working here, but she's not a midwife as such. She's a nursing assistant.
It's our two center.
Because of shortages. So she can explain the things that you want to know, but I just wanted you to be aware that she's a nursing assistant. Because of shortage of staff, there's no midwife to take care of the
We have got only one, but she's not there at the moment. She has gone for workshop, which is starting tomorrow for 2 weeks. And we are 3 trained nurse assistants with only 1 midwife.
And for the whole clinic?
The whole clinic.
But we have allowed him.
robust.
So
What I'm trying to say that is, we have got only 1 midwife here. We are 3 trained nurse assistants, but she's not there at the moment. That's why I'm dealing with the deliveries. We are really running short of staff. We are short-staffed.
Can you tell me about this clinic, the kind of things you do here?
Pardon?
Can you tell me about the people that you take care of here, the things that you do?
We have got curative here, under 5 clinic, art clinic, and I can say we are doing almost every health services we are expected to give to the community we are serving here.
How many babies have been born here this year?
This month?
This year?
Oh.
this year, that means this month.
Yes, since we're in January 2008 now.
Oh,
This month we have got only 3. This is the 3rd one.
but last year, how many were born?
Last year, I'm even new here. I don't know how much they had. I have got only 2 months here. So really, I don't know how much they had.
How many people do you treat on a weekly basis? In a week, how many people?
Weekly.
In a week, how many people will be through?
Plus, minus, to mean outpatients.
Yeah, any kind of patients. How many people a week come here?
I can check the register.
Can you just estimate?
Doesn't have to be that, just generally.
Is it 5? Is it 10?
In a week,
20? Yes.
In a week, the plus minus 40 to 50 patients a week.
On all kinds of.
Yes.
Can you tell me about this wall here with like the stuff about baby care?
This one?
Yes.
Yes.
The malnourished one and the kwashiorkor. We don't have this severe malnutrition here, honestly, but it's true that we have got underweight kids, but not as severe as this. We had only 1 baby with this severe kwashiorkor that we transferred to the hospital yesterday. Normally, we don't have this terrible malnutrition in kwashiorkor.
And what are the major health problems here?
What are the major health problems?
What kind of, what's the most common sickness?
The main major, the major problem that we have got now is the high rate of HIV transmission. We have got many infected people with HIV. That's what I think is the main one.
And what complications having HIV is? What kind of problems do you does that cause the people health problems? They're having problems with malnutrition or
food is one of the problems they are coming into contact with. The poverty is contributing a lot. Another thing is the clients that we have, it's not so easy to follow them. And because of poverty, they don't afford to come to us. And as far as it's not easy for us to go to them, that is still a problem. Because they are there, we know that they are there, but it's not easy to follow them. And they don't afford to come to us.
Where else could they go?
Pardon?
Where else could they go? What are the alternatives?
No, as far as this health center is concerned, they cannot go anywhere else except they come here. And there are some of them who are far from the health center. This place is really very broad. And there are places where we cannot reach them and they cannot come to us as far as transport is concerned, and financially they don't afford.
So if they come, now for instance, a woman is pregnant. Woman is pregnant, and you would test that woman routinely. Would you test a pregnant woman for HIV?
Normally, we test them when they come, during the first visit.
Yes.
Then it's going to depend on the result they had.
Yes.
If ever the lady was negative, it's obvious she's going to be checked after 3 months.
That's where?
After 3
I
months,
see.
if she was negative.
I see.
So if she's positive, we enroll the lady in PMTCT program.
I see. And then during pregnancy she gets whatever the program is. She gets Nevirapine, she gets a drug, treated.
Yes.
And then after the baby's born,
Even this one is the PMTCT one.
yeah,
So I have given, I gave the mother
yeah,
when the labor is established.
yes,
So after delivery, I gave the baby
yeah,
NVP and AZT.
yes.
Yes.
And then would you advise her about the baby?
I advise the mother that she can send the baby to Baylor for the test, because here we do it only when the baby is 18 months.
Yes. Right. So in the meantime, what does she do with it? Does she feed the baby on the breast?
She preferred to feed the baby exclusively for 6 months.
Good. And after 6 months?
After 6 months, the baby is willing to stop breastfeeding, then she introduces.
She doesn't have to stop breastfeeding. She can go on with the breastfeeding, and after 6 months.
After 6 months.
She can go on and add food. The baby's stronger then. Understand?
Okay.
Now, that means asking the question, do some of you go to workshops?
Yes, we do go.
Because the workshops update you on that.
Yes.
Right. So, can you treat women who are HIV, other people who are HIV positive, on the antiretroviruses, drugs?
Yes, we have got many of them treated here.
And you
They
treat
are initiated down at St. Joseph's. Then, after initiation, they come here for their reveal.
I see.
Yes,
And
for the
then-
monthly reveals.
I see. You try and monitor them, but it's difficult.
Pardon?
You try and keep an eye on them.
Yes, we
It's
do.
difficult.
It's not so easy, but we are trying our best. But it's not so easy, honestly.
Okay. No. Because of the distance.
Yes, the plate itself is too broad.
Yes.
We are short-staffed,
Yes.
so we have got many of them. When ourselves, we are very few. So it's not easy to reach every one of them.
Right.
Yes, but we are trying our best.
Are they supposed to come every month? How often are they supposed to come when they're on treatment?
They come monthly
Monthly.
for the refill.
Yes.
Then there's a doctor who's coming on a monthly basis to come and see the patients. So that is when the doctor sees them.
I see.
Yes.
And then advises them to come every month to get
Yes.
more.
They come monthly only for review. For
Yes.
the review of the doctor, they come after 3 months, some
I
of them,
see.
some after 6, depending on the condition of the patient.
Okay.
Yes.
Okay. And you do this with it's a government clinic.
This is not a government clinic.
And nobody else works with you, only the government.
From the government?
No, nobody else, no,
No.
nobody else.
So if it's not a government clinic, what clinic is it under?
It falls under child.
Oh,
What's a child clinic? Child is this association of private health centers.
or Christian Health
Yes,
Association.
yes.
So it's one of
It's
the
one of
Christian
the-
Health Association
Yes.
clinics.
Okay.
Under
Not
Roma
a,
Hospital.
but not a
Under St. Joseph's Hospital.
under Roma Hospital. So that's the major hospital.
Okay.
We'll get to see that hopefully tomorrow.
Okay,
Soon, yes.
okay, good. So doctor comes once a month and checks them. In 3 months they get tested for the improvement of the treatment.
Yes.
Good. Only the problem is to get them to come back, right?
Yes, it's some of them, they volunteer just because of
Yes. Right.
an easy means of coming here
Right.
as far as finance is concerned.
Do you think they do well on the treatment? Do you think they do well on the treatment?
Those who adhere well
Yeah.
to treatment, they are very nice.
Very well.
Yes.
We asked what's the main problem, and she said, actually, what about TB?
Yes, we have got TB as a problem as well, particularly most of them who
Yeah.
has got TB is they are positive, they are HIV positive.
Yes.
Yes.
And you treat them both. You treat for TB.
Yes, they are
and
treated for
HIV.
TB.
Now, what about leprosy? Yeah.
Since I arrived here, I've never seen any leprosy clients. Yes, maybe they are still there, but we don't reach
Right.
them.
That is not, it's not very high. Mostly it's for field workers, people who work in the field who identify
I see.
people with leprosy, then they can refer. There's a central leprosy hospital
Right.
where they go to. But there are people who can dispense the medications and
Right,
things like that.
right.
Field health workers.
Question, please ask what she needs to make things better, or what would make things better.
Overnighting e ka etsang dintho di le bitrenyana mona mosebetsing wa lona gore le tsebe ho thusa batho ka mokgwa o utlwang hore ho ka thusa.
I think the staffing pattern needs to be improved. That is the only solution, I think.
If you have and you're delivering, and in she, sorry, he can't hear me. If you're delivering a patient, and the patient is obstructed, right, or hemorrhage, what can you do
If she has got hemorrhage
if she's got obstructed
after
labour?
delivery,
What will you do if she's got obstructed labour and the pregnancy doesn't proceed?
if she doesn't give birth well?
Yes.
It's true that it's a stress to find that kind of a client, but it doesn't happen. We don't come into contact with that.
Yes.
But if it happens by mistake that we have got that kind of a client, normally if we are more than one,
Yes.
it would be terrible if it happened when I'm only
Yeah,
one.
right.
But if we are more than one, we used to be together and try to help the lady.
Right.
Yes.
And if you can't,
I will have to transfer her to the hospital.
that's what I'm wondering, how do you do that? How do you transfer?
We have got an ambulance.
Aha.
We normally call an ambulance to come and collect any
Right,
thing
the
that
ambulance
we
comes on those terrible roads.
And how long does the ambulance take to
from
get
the
here?
hospital to here.
Yes. From the time normally you would call an ambulance till it arrives here, about how long? 20 minutes, 1 hour?
It's more than that normally.
More than 1 hour?
More than 30 minutes. Still going to depend on where is the driver at that time when the ambulance is called.
Wow.
But it can happen that when ambulance is needed, there's no driver, they are still searching for the driver. That's some things that we meet sometimes.
So then they go to the hospital, that will take about half an hour, 40 minutes, but the hospital will admit your patient.
Yes, but they normally admit them.
Right.
That
But
is
I'm sorry. Yeah, they normally admit them?
That is the hospital that we normally refer our patients
Okay.
to.
Right.
And how long does it take from here once the ambulance takes the patient to the main hospital, how long a drive to the main hospital?
Honestly, I don't know the kilometers from the hospital to here.
That
But
type of
that one
way?
still depend on the way the driver is driving the ambulance from here to the hospital. I don't know the kilometers there.
Well, even though we don't know the kilometers, but it may take time just to transport from here to the main road here.
Yes, just
And
to the
then
main road.
going down, I think we can try to estimate the time from when we leave Hansi to get to St. Michael's, then to 10 to Roma. That's a long, it could be 40, yeah, almost 40 minutes, depending on the transport.
So about the earliest you can really say you have done your best to get an ambulance to here and get the patient transferred to the main hospital is an hour and a half. From the time the ambulance leaves Roma to get here, if all goes well, it's 30 minutes. Then another 40 minutes
Yes.
to Roma.
And it doesn't even mean that when you call for an ambulance, you'll find the ambulance sitting there.
Yes.
It could be unavailable. The driver may not be available.
Or the car may not be.
Or even the person authorizing the trip may
May
not
not be.
necessarily be there. So
Or the
there-
car might not even have petrol.
Yeah, that to come up to this end. So there are, I think to me to be more like an hour, because usually when you deliver a message, it doesn't necessarily mean that people respond like it's an emergency in a proper emergency setup. So there is that, who will be going to such and such a place? I mean, there are lots of things that need to be cleared. So
Because when we call, there is a security guard who's going to answer. Then he will go and tell the maternity people. Then the maternity people will then tell one who is responsible for the transport. It is true that it's a long process.
Yes. But at least you have an ambulance
At
service.
least we do have.
We do have an ambulance.
Yes.
So it's better than some places.
How about communication?
We have got a telephone here.
Okay.
Yes.
You've got electricity running
It's
also.
not working now.
It's not working now.
This night it's not working.
The telephone is not working now. So you wouldn't even be able to call an ambulance if you needed it now.
If I needed it, I could have used my own cell phone.
You'd have to use your own cell phone.
So cell phone.
Okay. And if the patient has a lot of hemorrhage postpartum, can you give blood?
No.
Can you give put a drip up?
Yes, the triple can put it up.
But you can't give blood.
No,
No, can you give drip?
we don't have blood here.
But mostly it's normal, right?
Mostly it's normal.
If someone deliver at home and then call you.
For delivery?
No.
They don't. They only come after delivery.
Okay. Twins? You deliver twins?
Okay. Thank you very much.
Thank you so much.
Yeah.
na ampha menga ka ola ke
Okay, I'm Zena Stein, and I've come with Teddy and Bob Cabell to work, and with Sam Makwena, Sam Mapiko, to Tika, to spend a few days in Lesotho and understand more about the relationship perhaps between health and culture and community. And Teddy began this conversation in New York, and now we're continuing the conversation here, hoping that we can together work out some way in which we can make a contribution to the country, especially health and culture.
And you're here now with?
Caseli.
But
I'm here now with?
I'm here with
Caseli.
Casaline, who her name is Casaline
Matemili.
Temeki. And she
Excellent.
said I can call her Casaline, and I said she should call me Zena. Right?
Now just tell me your name again so we have it clean.
My name is Matemile Caseline Demeki. Yes, I run a Caseline Healthcare Center, which was opened last year, September 2009. Well, it was founded by a support group called Lesotho Support Group. Our Lesotho means a thing that you can trust worthily. So we started a support group. We did the home-based care, counseling. Well, by the year 2007, we decided to make a community clinic. So it is now well established. Well, we do the primary health care, curative, and as well as maternity and under 5. Well, the government has just given us one doctor who does the part-time, and one nurse who does the part-time, 2 nurse clinicians, and a maternity, a midwife nurse. So we are registered. So I think I'm very happy to meet with
Right.
Mayor
Yes.
Messina, who is from New York. So I think if we link,
Yes.
I think something will be produced
Right.
very much for
Right.
our communities. So, and the Ministry of Health does much in our health center, because now it has let out some 6 counselors who do the counseling and the testing of HIV and AIDS. And the Ministry of Health of Agric has also supported with the milk goes. The milk is being given to the orphans and the patients. It does well, it cures diarrhea and nausea. And now we are looking forward to go and make Malelega and Farm Center that will produce some fresh vegetables, some maize and millet as staple foods that will be given to the sick, to the orphans, as well as to generate income. Yes, I don't.
Right. Very interesting. How did you start?
Okay,
What were the
Zina.
first things you
Zina,
did?
ask the questions.
Well, I mean, without looking at.
Yes, look at me and ask the questions.
You mean
Well, I
No,
think
just wait.
all right. I'm interested in your own background and how you came into this. I'm interested in what the community centre did before it set up the primary care. And I'm interested in the primary care, do you see general patients and do you deliver women, or what are the services that you try and do at the primary care?
Okay, now you have 5 minutes to tell me all those questions.
well, the community before were traveling some distances to some health centers in the country. So we try to put services near and should be affordable and available.
Yeah.
So that's why we started the clinic.
Yeah.
So we were giving the TB patients some drugs. Well, they are being given packages in the hospitals, so we advise them. They are being put in our clinic so that we can help them. Now they take the tablets every morning.
Okay.
Yes, so the services are near. And those we were going to deliver were walking some distances and queuing some lines. So now we have attended to 32 expectant mothers. 32 were born, we only had 2 still birth. So I was trained as a birth attendant. Yes. I do in the presence of the midwife nurse. Even when she's not there, I deliver women.
Yeah.
Yes. I'm also a counselor.
Right.
Yes.
No.
You should start. They didn't capture that. Sorry.
No,
Zina,
that is not.
They didn't capture that. They didn't
It's not
capture
my
the last-
field, but I have a talent.
Yes, I can see. Yes.
I'm not. I worked in the family planning clinic since 1978 till 1995 when I had a retrenchment. So now they wanted to take people with masters. So I had to stay home, but I asked them that now I wanted to do the work too. So
Right.
they provided a document that was to be given to the government
Yeah.
so that they could allow me to do the job. So I continued my motivation, my education. That's why I started a support group, and now it has grown up as a clinic. Now I want to make a farmyard now, this time.
Right.
Yes.
So you started with a support group. What was the idea? What was the support group supporting?
Supporting people who are HIV positive
I see.
and orphans of
I see.
HIV
I see.
and needy people and elderly people we support.
Right. Right.
Yes.
Very.
We educate orphans.
Yeah.
We clothe them, we feed them, we take care.
Right.
Yes. And where there are no funerals, where people have not made preparations for burials,
Yeah.
so we help.
Right. Right. Right.
Yes. The group members are just making some subscriptions.
Right. Right.
Yes, and we had one donor from Wales, from Baptist Church. So they donated money that helped in building a clinic. Yes.
So now you've actually built a clinic.
Yes.
A building from
I
that.
can show you some pictures here now. That were the clinic.
Right.
And now we also teach the herbalists about physiology and hygiene and how to handle. Yeah, we are dealing with the herbalists now.
Right, right.
Yes.
Is, would you say that HIV is the major problem, health problem
Yes.
in your community?
Yes.
Lost many people?
Yes.
You have. Because you can tell from the orphans. And how do the orphans, do they live in their own homes, or do you have a group home for orphans?
They live in their homes. We don't have a house for them, but now I think in the next future we shall be bringing them together now. Yes, we are educating them now, clothing, feeding. We are now coming to make food, produce food for them. So I think housing will come later.
Right, right. So in the night time they go home. Where do they go at night? They sleep?
No, they don't sleep in my premises.
Yes.
They sleep at their homes
Okay.
with their families.
Right. And then they come in for meals and for the 7 days?
Yes,
Right, right. And is it a job? Is it working?
it does.
It
That's
does.
now I'm looking forward to build the kitchen for them to supply the breakfast, dinner, because they have lunch in their schools.
Yeah, right.
Yes,
How many are there?
I have 20,
20,
Mm.
all ages.
all ages.
All ages.
But now we have identified 140, but we can't manage. We only have 20 in number.
In the community,
Yes,
140.
140.
So how many villages in the community?
We have 5 villages.
5 villages.
Yes.
And now he wants me to ask this. Now that you have where you are, what's the things you mainly need?
Well, we need a support from all over, from people who can help us with clothing, something to make us to grow some vegetables, some crops like maize, millet, so that we can produce food for us.
Right, right,
So now I think we are looking forward for plowing.
right.
Fencing, well, we have a little now for making, I think we have 5,000 now for fencing.
Right,
But now we don't have some other materials now.
right.
Yes.
Now, I'd just like to ask a question. What are the activities in the daytime for the orphans? How do they play? Do they have a teacher? Do they sing? What are the things that happen in the daytime?
They see,
They sing.
they knit, they sew, they plow in the gardens,
Right,
well, in the next future in the fields.
right, right.
And they dramatize some dramas.
And what?
Dramas.
Drama. I see.
Yes, I'm a dramatizer.
Right, right. And you work with them?
I work with them and some other people who work in various jobs.
Right.
Yes, I have some other educated people who have joined us.
Right. No, I don't want to ask that. He wants to ask, not me. How old are you? He wants to ask.
I'm hardly 60 years. On the 3rd of February this year, I will be 60.
I wonder, what is it that the clinic, the hospital sends you? You said the hospital sends you packets. What medicine is it from the hospital?
Yes, I think we can also need some various medicines, drugs, because we have the doctors, we have nurses, we have nurse clinicians.
Yeah.
Everybody is involved.
Right.
Yes.
Now, when the patients are HIV positive, then do they go to the hospital for treatment?
They go to the hospital for diagnosis. After being diagnosed,
Yes.
they go back with their package. So then we make a follow-up.
You make a follow-up?
Yes.
Ah, and so you make a follow-up that they take the medicine
And give it to them.
and
And when they are sick,
yes,
apart from HIV,
yes,
we give them medicines.
I see.
Yes, in the local.
Okay. And
thing.
what about who feeds the babies? How the mothers, if a mother's alive and she has a new baby,
Mm-hmm.
you help her with breastfeeding?
Yes.
Yes. Well, how, the nurse, were you experienced in that?
Yes, I have some nurses
Yeah,
who talk with them.
right.
Yes.
And how do they advise them?
Well, they teach them to that they should feed their babies. They should with their breast milk because
Right.
it's the most important.
A plus. and then when they get a bit older, then they have to have other food, right?
They have artificial feeding now.
Traditional.
Artificial feeding.
They do.
Yes, they do.
Where do they get that?
From their homes. Those who don't have, the clinic supports.
Clinic support.
Yes.
Right.
That's why I want to make a big farmyard now
Right, right,
for those who cannot afford.
right. Afford. But they start with the breast milk,
Yes.
and then this is after.
Even those who are HIV positive, I think we delivered 3 who are HIV positive. They were given some tablets from the government. They are doing well. They suckle their babies now
They what?
for 6 months.
Yes.
Yes.
Okay, okay. Now, do the babies get injections, vaccination, immunization?
Yes.
You give them,
Yes.
and the,
My nurses.
and the hospital sends the material,
Yes.
like for measles?
Yes.
Yes, and so you
All
do
the
that.
vaccines.
Right, right.
Yes.
Now, if the mother, a woman is pregnant
Mm-hmm.
and she's tested
Mm-hmm.
by you,
Yes.
and then you follow through with the drugs, medicine for her that she must take?
No, we refer them to the hospital.
Okay. And so if a woman is pregnant
Yes.
and she's HIV positive,
Yes.
then you refer her to the hospital?
Yes. But now
Yes.
the antenatal clinic
Yes.
is being done in our clinic.
Aha.
Yes.
Good. And then you'll give her advice
Yes.
and counselling,
Yes.
and you'll give her the drug too
Yes.
to take.
Now they go to the hospital to get the nephropin. That's
Nevirapine, right?
yes.
You can't give that.
No.
Okay. And then she gives to the baby too.
When she comes back, she shows us
Right.
the nephropin. Then she uses the nephropin 4 hours before delivery.
Okay.
Yes.
Okay. Very good. And then if she needs more care, then you're the follow-up from the hospital. If the hospital puts her onto other medicine, drugs,
Yes.
then you will follow. The hospital write you a letter telling you?
Yes.
Okay. When she comes back, she comes with a letter.
It does because we refer them to the hospital.
Right.
Now in return,
Right. So it's the relationship between you and the hospital, and you know, is good.
very good because now the hospital has supplied the doctor, the nurse, the counselors.
Yes.
And that now the equipment that is being supplied for HIV is from the government.
Yes.
We
I
don't
see.
pay those people.
No.
They are being paid by the
Right.
government.
Right.
Yes.
So you started with no support from
Yes.
outside,
Yes.
just the community.
Yes.
And then as you wanted to put the primary
Healthcare.
care, then the government started helping you.
No, we didn't ask for
No.
for help.
Right.
We just studied.
And did nobody
On
pay the nurse?
No,
Nurses working volunteer.
no. They work on voluntary basis.
And who pays them?
We are not paying them yet.
They work on a part-time, even now.
Even now, but we like to pay them, but we don't have money to pay.
No.
Now, hence we have started. We hope the clinic will make money.
Right.
Yes.
But at the moment, the patient doesn't pay. When a person comes,
They pay.
they pay.
But now, hence the clinic is newly built. We buy clinic equipment.
Okay. Okay.
Like now we have bought the bath lamp, the baby scale. So we are buying
So
the
you support yourself.
yes.
And the only thing the government gives you is the medicine, the drugs, Novorapine.
Only on HIV.
Okay. But then the others need injections. The baby gets injections
Yeah, well, and the vaccines
that
we get free.
from the hospital.
Yes.
Right, I see.
But now for curative we buy.
Okay.
Yes.
For which you buy?
For curative levels we buy the medicines from the pharmacies.
I see.
Yes.
I see. So some of the medicine the government buys, some the hospital gives you, and some you buy yourself.
Yes.
Okay. Who runs it? You.
Yes, because I'm the founder.
Right. It's marvelous. And
I run, but I'm supported. I'm greatly supported
right by the community.
by the community, the government, and everybody from outside.
Right. Right.
Like last year, December, there were people who were from America, Black Americans. They supported us with children's medicines.
Right.
Yes.
Right. And
And looking for orphans and needy people,
yeah. Right.
and some blankets.
Right.
We're
Right.
very much
Very
blessed.
short of blankets. That's one thing we talk about.
And the
this one.
sheets.
Right. And is there a teacher? I mean, you do the children, the orphans. Is there a school?
No, they go to various schools in the country here.
They walk. How
They
go?
walk.
They walk. So yeah, they walk to school. Orphans.
Yes.
When they're old enough, they
Mm-hmm.
walk to school.
Yes.
Then they come back to you.
Yes.
And when they come back to
We
you,
only supply the bus fares.
right. And the children understand that why they're orphans. They understand.
They do, because now they are in Form 5 classes now.
Yeah.
Form 4, Form C. Some are 21, 23, 24 years old.
Yes.
Yes, they do
They
understand.
understand that. Yeah.
Mhm.
The older ones, do they have idea about prevention, sex, these issues? They have
Well, we have
adolescents.
not yet come to that point, but we give education.
You give education.
Yes.
Because we visit many people, and the one man we visited in Hansi,
Yes.
then he described to us how he has groups of the adolescents
Yes.
and discusses sex and prevention. And he was a teacher himself,
Yes.
and we were very interested.
Well, in my vicinity, well, they don't use protection. Well, maybe they get it from other clinics.
That's right.
But as I am a guardian now, they can't show me that now they use some protections. But education we give.
You do, but you don't have condoms.
We have
You
them.
have condoms.
Yes.
Female condom for women.
We don't have now.
I'll buy you some. But with the female condom, you have to train the woman and the man.
Yes.
Needs more training.
No, we were trained in February 2005 by the government.
Right. That's very good. And family planning,
I do the family
you
planning.
do.
Yes, because I worked for 28 years in the family planning clinic.
And with people who, if a young person comes for family planning, you also do VCT.
Yes, we do.
Yes.
In my bag now, I'm going to. I told you that my time was limited.
Oh, you gotta go. All right.
But I do say, well, I'm going to the factory now.
Yes.
I offer the service of family planning.
Right, very
for
good.
the young women.
That's very good.
I dispense tablets, injections.
Yes,
Well, I was taught how to insert a loop.
yes. Right, marvellous. All right, she has to go, and I'm excited. A wonderful discussion.
These are the witch doctors who had come to TV supporting TV supporter training. So we're training them how to diagnose TB from mere common cold, and how to treat them, and how to help them when they are from the hospitals.
What does that mean?
This is the clinic.
What is laparoscopy?
Yes,
What's that mean?
maternity,
Maternity. Oh,
curative and maternity.
okay.
Yes. So here we have the tram. Well, we were dancing after this picture had been taken. Here I am now with the red material. So I've worn beads on the head like them now, because it's how they put on their clothing. So, and amongst us, hence I said we have nurses in our clinic. The one in white is a nurse who is working in the clinic. Hence I said we had a administrator is this one. She's from Nal, she's a teacher in degree. This one.
Okay.
Well, this picture here now shows entrance of Castelline Healthcare Center now. So this is all.
Is there a, how does she and the nurses and the community learn about new things in relation to HIV, TB, infant feeding? Do they get some people visiting them, or do they go on many courses?
Government is providing some seminars, conferences.
Okay.
Yes,
And you go,
we go.
you go, right?
Yes.
Because it's important, because it's new things are being learned.
Yes, local government too.
Yes.
Everybody in the government is willing to help the support crew,
So
willing to help the clinic with skills, knowledge, training.
right,
Yes,
right. And so government supports you to go.
very much.
We should add that one, it's important.
Oh, thank you very much.
Thank you.
Hey,
Very nice.
the needles, these needles is a gift from John Scott, an Englishman.
John Snow. From
John Scott
Oh,
from England,
England.
as well as the syringes through the office of the First Lady in Lesotho.
Mm.
Well, this I buy from the Family Planning Clinic. Yes. And the Deco-Profil, the injections. Well, the Petrogen here now is an injection, a 3 months injection.
For family planning.
Yes,
I see.
I buy from the pharmacies.
Okay, women like that.
Very much,
Oh, yeah.
very
They
much.
haven't got to think.
And we run scarce of this,
Right,
and the family playing tablets, I can say.
right, right.
Yes. Well, I think we can be very grateful if we can be supplied with this in our
Right.
clinic.
Right.
Yes.